The arrival of a third COVID-19 vaccine is expected in many parts of the country this week. Johnson & Johnson's first distribution batch is en route to different states. WALB News 10's Jennifer Morejon joins us live with more about the vaccine and when Georgians are expected to start receiving it.
Jim, there are two very important things about this vaccine. First, it is only one shot, making it convenient for people, especially for those who don't like needles. And second, the storage. It does not require freezing low temperatures.
This will only be necessary to be kept in the refrigerator, and it will keep in the refrigerator for up to 3 months, which is going to make that, what they call that last mile of distribution, much easier, much more simple for retail drugstores, retail pharmacists, grocery chains, health departments that may live in a little more rural areas.
Scott Smith, Director of Pharmacy Services at SGMC, tells me he is excited the public has one more choice available. He says this easier storage will be the key for communities without the means for freezers. And there's one more thing making the Johnson & Johnson vaccine unique.
This vaccine in the United States tested 72% effective against prevention of the disease. But the part that is a little bit different is that the testing criteria were different than the other two. One of the things that this vaccine tested against too was hospitalizations, prevention of hospitalizations, and prevention of severe illness, not necessarily just prevention of disease itself. And so in those two criteria, it tested extraordinarily high.
Smith says from what he is hearing, Georgia should be receiving an initial distribution of 83,000 doses statewide on March 8th. The Department of Public Health will determine where the vaccines will go throughout the state. Smith says vaccines will go primarily to health departments because they have access to wider scopes of communities.
And a lot of the data and a lot of the research that I've read talks about this vaccine particularly helping in outbreaks. In other words, if you've got a spot or an area of the country, area of the world that has an outbreak, that it's much quicker to the end with this one.
And for those unsure about which vaccine to receive, Smith recommends getting the first you can find.
The end of the day and the development of the immunity that we need as a community, it's not going to matter which vaccine that you take. What's going to matter is that you've been vaccinated.
Smith tells me SGMC is not sure if they will be receiving any vaccines at the moment. In Valdosta, Jennifer Morejon, WALB News 10.